Good evening once again, and welcome to yet another very interesting session about intellectual disabilities. I remain my humble self, Lucky, Dr. Drugs, and today we'll be talking about intellectual disabilities. We'll talk about the relationship between autism and ADHD. We'll talk about Down syndrome, cerebral palsy, and dyslexia. About the introduction to these topics. Yes, I remain my humble self, Dr. Drugs, and autism and ADHD, Down syndrome, cerebral palsy, and dyslexia intro by me, Dr. Drugs. The table of contents is very simple. We'll talk about autism and ADHD, basically. Down syndrome, we'll talk about briefly. Cerebral palsy, we'll talk about briefly. Dyslexia as well, we'll talk about briefly. So we're going to just run through very fast what we talked about autism in the past. Of course, we know that it's a neurological and developmental disorder that affects communication, social interaction, and behavior, and is also like a silent epidemic. We also would agree that depending on the stressors, the environmental norms or the norms in the society, as well as the ability of the patient or the person that has autism or the person involved to withstand the stress or the stressors, one may or may not be termed to be autistic as a factor, meaning that everybody has to, in one degree or the other, an intellectual disability. Depending on how the person is exposed to these three factors, then one can be termed to be autistic or not. I'll give a typical example about giving people a large dose of alcohol, and then we begin to see that the autistic tendencies begin to appear. In some cases, when people get angry, hungry, or under serious stress, their autistic tendencies begin to appear. Talked about the different types of autism. Then talked about the signs of autism. We talked about the risk factors as well. Yes, we talked about the complications as well. Talked about management of autism. These are all available in the previous videos that you can find on different social media platforms. Of course, then we'll talk about the comorbidities. That's the other factors that go alongside with autism. We talked about the tips with regards to dietary tips, the things to avoid. They will talk about casein, dairy products, gluten, monosodium glutamate that's found in Maggi, Knorr, and all that. We talk about refined sugar, soft drinks, and all that. And we talk about the chemicals to avoid. Then we also talked about chemicals in cosmetics to avoid, because we know that our children are often attached to our mothers who always want to look so beautiful and attractive. But unfortunately, some of these chemicals that in the beauty industry are contraindicated in autism. Of course, then we talk about some things contraindicated in creams and lotions. Then we talked about other matters, like people thinking that autism has something to do with witchcraft and all that. We talked about that as well. Counter that notion, which is completely wrong. Then we talked about the importance of natural pharmaceuticals in the management of autism. Yes. Then we also talked about the management of autism via improved neural connectivity. And we also emphasized that it is that the earlier, the better, because the human brain is malleable, adaptable, or changeable, and this is how the brain learns and stores information. But this process is faster and better when the child is younger. We talked about how the brain changes. We talked about change via experience, applied behavioral analysis, ABA. We talked about then nourishment, which is supplying necessary materials needed by the brain to transform, improve, and support neural connectivity directly and indirectly. So the brain changes or learns or adapts via improved neural connectivity. This is very important that we're saying this now, because it's also applicable to other intellectual disorders like cerebral palsy, Down syndrome, and dyslexia. So we talked about ABA, which is applied behavioral analysis. Then we talked about what I call the 10 commandments of ABA. All these are available for us to watch later. Then we talked about brain nourishment, the diet do's and don'ts. You know, we also emphasized that nothing else can enter when the brain is not adapting to receive more information. So when we're giving therapies and all that, without the brain modifying itself to imbibe these things that the child is learning, it is virtually useless. That's why it's very important that the brain receives the appropriate nourishment to help it to adapt and learn new things. That is what we're basically talking about there. Then these are just a few examples of the things that we need to talk about, how we have a lot of products out there that have DHA, docosahexaenoic acid, and EPA, eicosapentaenoic acid, which are very, very essential with regards to brain health and function. But unfortunately, we have a lot of fake out there, and we have to be careful. Also emphasize on how it's possible to put water in a glass cup, bust a few capsules, and take styrofoam and drop in there to know if the product is original or not. Choline, which is a precursor of the neurotransmitter acetylcholine in the brain, talk about how important it is as well. Vitamin D, which God has given us in abundance, since it's the sunshine vitamin, our skin produces it when it's exposed to sunlight. These are the wonderful uses and importance with regards to autism. For example, Q10 that our grandpa and our grandma takes with regards to hypertension and all that, you can see it's also very highly indicated. We talked about aloe vera, which has been used for thousands of years for a lot of things. Talked about how it is indicated in intellectual disabilities. Talked about probiotics. We keep hearing about probiotics all the time, but people don't even know that probiotics can help us with regards to this intellectual disability. Yes. So also talked about diets, do's and don'ts. Give examples of the things that are to be avoided. Of course, talked about the artificial colors. We listed very popular ones that are very common, and like tetrazine, that's yellow 5, sunset yellow, that's yellow 6, allura red, and we have red 3, which is erythrocin. Allura red is red 40, and amongst other things like the preservatives and all that we also mentioned. Then, now we talked about these additives actually being able to trigger or worsen the causing of autism, which is attention deficit hyperactivity disorder. You understand? So these additives can trigger or worsen hyperactivity, inattention, impulsivity, irritability, anxiety, sleep disturbances, gut issues, and other issues. Like I mentioned, one of my favorite animations, which is Gumball and all that, talk about how if you want to know what ADHD looks like, go and watch Gumball. And it seems so funny, but just true, because I really enjoyed that program a lot. Now, we also talked about how refined sugars affect autism, because we keep hearing about refined sugars and refined carbohydrates affecting autism, affecting children with autism. So we have to go deeper. You know, this is just a little more. We talked about how processed foods affect autism. Talked about the food consumed in autism. These are the things to consume in autism. Now we are here, autism and ADHD, Down syndrome, cerebral palsy, and dyslexia intro. Okay. So, autism and ADHD. What is the relationship between autism and ADHD? ADHD and autism are separate neurodevelopmental disorders, but can share some symptoms. Remember I mentioned that ADHD is the cousin of autism. Both conditions can affect attention spans and communication, but bear in mind that a person can have both ADHD and autism. So approximately 30 to 70% of individuals with autism spectrum disorder also have attention deficit hyperactivity disorder, ADHD. So you can see that and approximately 20 to 50% of individuals with ADHD also have ASD. So you see that they are very closely related. That's why it's very important that we talk about this. So how do we really differentiate both of them, and how are they, how can we relate both of them? So you can see, is it really possible that they are actually related somehow because of the presence of one when the other is happening and the presence of the other when one is happening, So why ASD and ADHD are distinct conditions? They share some common symptoms such as difficulty with social interaction and communication, repetitive behaviors, sensory processing difficulties, attention and focus challenges. These are things that are common to both of them. But however, autism is primarily characterized by what? Social communication difficulties. That's why I see that autistic children sometimes find it very difficult to look at people when they're talking to them because of and there's a wide gap when it comes to being socially active, active. Then there's restricted and repetitive patterns of behavior that's characteristic to autism. Now, ADHD, on the other hand, is primarily characterized by inattention, hyperactivity, and impulsivity. Because you can, from the name, attention deficit hyperactivity disorder. In fact, the name of the problem has defined the problem automatically. So the exact relationship between autism and ADHD is still being researched, but share underlying genetic and neurobiological factors. That means they are related from somewhere and may contribute towards the co-occurrence of these conditions. That's why it's important to know. But we'll talk about ADHD later. So these are just examples of some of the things that I use for my patients, and I'm having very wonderful results. And many of them contain some of the substances we mentioned before, like this contains EP and DHA, which we mentioned, which we mentioned the function before. This contains choline. This contains cobalamin and folate analogs and other analogs of the B family, vitamin B family. This contains thiamine and other things important for improved brain function, which is very key in regards to resolving autism. Of course, and also as well as ADHD. Calcium is necessary because the calcium in the milk that has been withdrawn because of the casein is necessary for bone development in children. The adaptogen here and the carotenoids help with brain function. This is where we have coenzyme Q10. This we have very high quality probiotics. This is where we also have calcium amongst other essential compounds that are good. Also, this contains chamomile for calming people down. Autism is associated with ADHD, and the child may be restless and all that. This contains fiber for gut health, and this contains very minimal chemicals that affect children with regards to autism. Remember that the mouth has a very thin layer. That means anything that goes into oftentimes things that go into our mouth find their way into the bloodstream directly. That's why you see when people are having some cardiac issues, a drug, something like sublingual nitroglycerin, is put under the tongue to help the patient to recover because it is going from under the tongue straight into the bloodstream. That means that when you are using the wrong kind of toothpaste, it contains things like triclosan and fluoride and all those things. They are very, very not so good. They are not so good for children that have autism. Oftentimes, you see, now because the child is not taking milk, it's a good substitute. The creams and this for cuts and wounds, because imagine that chemicals are mostly contraindicated and the child's skin is open. If you apply these chemical substances there, it could actually cause problems. It's for bed sores and all that. This doesn't contain aluminum salts and all that. So that's what we discussed before. That's that about autism, the relationship between autism and ADHD for now. Later, we're going to talk specifically about ADHD. So let's move on to Down syndrome. A woman actually told me that I keep talking about autism, why not talk about Down syndrome? And I saw reason in what she was saying, because other intellectual disabilities are there. Now, Down syndrome is a genetic chromosome 21 disorder causing developmental and intellectual delays. It's an abnormal genetic disorder caused when abnormal cell division results in extra genetic material from chromosome 21. The chromosome is found in the DNA, so that affects how the brain and the body develops. You understand? So we have different types. We have the trisomy 21, that's the full one that we know. We have the mosaic, which is the mixed. Then we have the one that's called the translocation Down syndrome, which is not of, these are the people you see in society that when you see them, you see features of Down syndrome, but you see that it is not actually not affecting them in any way per se, particularly, possibly. So because it's just minimal, just a stump, the abnormal chromosome is just there. And that is why you can see. So we'll talk more about this, just the intro. So we'll talk about these further later. Now, it's a random genetic error in cell division, because as the cells are dividing after fertilization and early fetal development. So the higher age, especially in women, is often a risk factor. For males, it's also about 10%. Now, it leads to physical and intellectual disability, as aforementioned, limiting mental capacity to that of an 8 and 9-year-old, but with high social and emotional awareness. That means, in as much as they are not able to relate like adults, they are often also emotional like every other person. So we have to be careful the way we relate with them. We don't have to make them feel bad as if they are not human beings. When we do that, we're actually hurting their feelings because they are emotionally sound, you understand, and socially aware. That's why we need to bring them around with love, because many of these situations are not caused by these children. They just found themselves like that. And that is just how it is. So it could have been anybody. It could have been anybody. So that's why I keep preaching this all the time. So this is how it's managed. Early childhood intervention is very important. Screening for common medical issues, super important as well. You see what I'm talking about? Having good family environment is also very important. You see, we need to talk about work-related trainings, proper nutrition, because remember that the brain needs nourishment that is essential for its proper function. Then we have physical, occupational, and speech therapy. That is also important. Then we have natural pharmaceuticals to help against comorbidities, health issues that coexist with it, and that they exist with this health situation. Now, we may not talk much about improved neural connectivity. That's a topic for another time. But we should bear in mind that is very, very important in regards to resolving this matter. Signs and symptoms are all these things we see here. So, ranging from congenital heart defects, especially there's another one called the trisomy 15, which causes a very terrible thing where there's a hole that bridges two compartments of the heart that's not supposed to be like that. We have hearing loss, poor vision, cataracts, hip problems, leukemia, and a lot of them. So we just have to make sure that we try our best possible to help these children as much as possible, you understand? So that we can follow these things the way that they appear and help these children to improve. So look at the causes and risk factors. Advancing maternal age. A lot of women are becoming career women, and then they believe that they don't need a man until when it's already getting late, or they feel that anytime they're ready, they can do these things. But let's tell ourselves the truth. This is a scientific fact. I'm a scientist. I know people say God's time is the best, but God has given us the time. So once God gives us the time and we keep choosing other times, then eventually one may find himself or herself giving birth to a child with Down syndrome. That's why it's important this is done early. And also factors that affect DNA integrity, like stress. Some people are workaholics, or taking cigarettes, excessive that's alcoholism, being obese, and all that should also be avoided. You understand? I'm talking about people that have had, maybe if one has had a child that had autism, Down syndrome before, it's very essential to improve lifestyle and hope that it doesn't happen again. So being carriers of the genetic translocation for Down syndrome is also a problem, as both men and women can pass it down, as we know, although it's more in women when it comes to talking about in terms of advanced age. It's a risk factor. Then having one child with Down syndrome already means that the tendency is there. So one has to be careful and precautionary measures have to be taken. Of course, men over 40 at the time of conception also have an increased risk, as well as mothers above 35 as well, particularly. So these are the comorbidities. Of course, we talked about a little before: poor immune function, slow intellectual development, heart issues, epilepsy, thyroid-related issues, and all cancers, type 1 diabetes. Meaning that because it's a DNA issue, that means it can affect any part of the body, because DNA is necessary to form all these organs, all that. So you see, it causes infertility, low immunity. So these things can be addressed individually. And that's why if one has a child that has this issue, you have to be patient enough to check and know exactly where the problem is coming from and begin to tackle them little by little, patiently. That is how it's done. So prevention and management, okay? Now, the best way to as for prevention, I'll just talk about marrying at the right time. I don't know the right time, I'm not God, but I know that it's best to marry and begin to give birth to children before the age of 35. That is very, very important. You understand? Because the risk factor the risk of having a child with Down syndrome is less based on what research has shown. So that's about prevention there. Of course, management involves physical therapy, of course, help with physical development, speech therapy, occupational therapy, behavioral counseling, special education services, and improve neural connectivity, because this greatly enhance giving the brain what it needs at an early age. You understand? Because the earlier, the better. The brain begins to at least mold itself in the right direction because it has enough material to do that. So this is well, because I often try to avoid as much as possible chemical drugs with regards to these ailments and conditions, because these chemical drugs themselves have side effects that we don't even know. I asked somebody that day, I said, all these drugs you're taking, where is it going to? The person doesn't even know. I had to show some people some of the side effects of this medication they're taking, and then they began to understand the importance of having very good life, making good lifestyle choices. And sometimes you just have to show patience, even though these drugs are some, the situation is just like sometimes one is between the devil and the deep blue sea. You understand? You just have to choose, you just have to give the medication within a safe limit to bring the child out of danger. But let's be aware that the less we need chemical drugs, the better. But doesn't mean we should contravene the rules and regulations given to our patients by health practitioners. Like, I would not like anyone to alter my prescription without even consulting, and so it's unethical. But please, let's try as much as possible to avoid the need for these chemical drugs by doing the right things. So this natural pharmaceuticals will help to boost immunity, manage the cardiovascular issues, especially something like coenzyme Q10. Essential fatty acids are very good for the brain, improve thyroid function. Yes, we have things that contain stuff like seafood and all that, iodine and all that. And then prevent and manage dental issues. Of course, we have things that have dicalcium malate and all that, which is better than the regular calcium people take. Of course, neurotransmitters like the choline I mentioned, the probiotics will help with the mitigation of gastrointestinal issues, to relax the brain. With regards to chamomile, does that, improve and maintain bone integrity. Of course, magnesium, dicalcium malate, and 1,2,5-dihydrocholecalciferol, also known as vitamin D, is also there. Of course, improve nerve function. We have the cobalamin analogs, the folate analogs. We have the pyridoxine, and all the thiamine. These are things that are very important. Then we have general regeneration and rejuvenation of the body. Adaptogens are there to help. So we're not going to talk too much about these because this is still an introduction, but everything we talked about just now, we can find them in different products we can see here, because a lot of people have different things they use, but these are the ones I have used for my patients and have given me very good results with regards to at least intellectual disabilities and all that. So in case we need to know more about this, we can always chat me up or contact me via any of my social media handles. Yes. So let's just quickly talk about cerebral palsy. This is intro. This is just an intro. So cerebral palsy is a neurological and a group of movement disorders that appear in early childhood and is caused by abnormal development or damage to the part of the brain that controls movement, balance, posture. That's why it has the characteristic defects with regards to muscle tone, movement, and coordination. Now, these issues that cause this problem often occur during pregnancy, about 80%, during childbirth, or shortly afterwards, up to about 3 years. See, so one has to be careful what we do during pregnancy and all that. Now, these are the signs and symptoms, which include delayed milestones, sitting, standing. A child that is not even able to sit for long is a problem. Standing, walking, or talking later than typical children. You understand? Because I have a child that at the age of about 9 months or so, because the mother knows that about heading to 10 months, the child was not walking and she was worried. She has every reason to be worried. And she came to me and told me, look, this child is not walking yet, and all my children don't normally waste time with this. So what's going on? Her elder sister started walking even before about 9 months or less. What's going on? I had to give the woman what contains choline, which is the precursor of acetylcholine. I gave her something that contained EP and DHA. I gave her something that contained thiamine and all these other things. And within 1 to 2 weeks, this child stood up and began to walk. And it's not a mystery, it's pure science, because the brain began to receive materials that it needed, you understand, and began to use them as fast as possible. So these are just tricks, because at that age, the child's brain is growing as super fast. So it's better you just inculcate the things that the brain needs, and it just puts them at the right places and begins to function better. That's one way we sort this thing. So muscle tone issues, stiffness and floppiness and all that, movement difficulties, coordination, because it affects the neuromuscular part as well. It also has a negative effect on the neuromuscular functions in the body. You see, talk about spasticity, that's stiffness or tightness in the muscles, seizures. Remember that there's a problem in the brain, which is often as a result of certain things we'll talk about shortly. Vision impairment. Remember that the brain controls almost everything you can think of in the body. So when there's a problem in the brain, anything can happen in the body. Now, speech and language difficulties, we still need nerves and muscles to work together to allow us to speak, to swallow, a lot of things like that. The part of the brain that is involved in recognition, somewhere around the hippocampus and all that, can be affected. You see the muscle spasm and contractures, abnormal reflexes, and a lot of other issues. Now, these are the risk factors. Preterm birth, you understand? This could also be a problem because of poor development. Being a twin, that is also something that I can explain to anybody that wants to talk about it in private, because it's a bit long to explain that. There are certain infections like chickenpox, rubella is also a problem. Remember that meningitis, that means the membranes in the brain can be inflamed. Pelvic inflammatory disease is just a way to deliver bacteria to the child and that can infect factors in the child that affect the brain. That's on that issue. The placenta, of course, we know connects the mother directly to the child, and you can see if that's infected. That's just like opening an express road for the child to also have issues. Of course, we talk about cytomegalovirus and all that. Then meconium aspiration syndrome is when sometimes the fecal part of the baby, the feces of the baby, finds its way into the respiratory tract, suffocating the child and depriving the brain of oxygen. You see, it's all about the brain here, nerves, muscles. You can see low blood sugar can also affect the brain. The brain needs sugar to function. We have other dangerous substances like methyl mercury exposure during pregnancy. Remember, I talked about very difficult delivery that may lead to low oxygen and also affect oxygen supply to the brain. This is also one of the problems as well. Genetics in just 2%, but unfortunately, some people fall into that area. Then severe jaundice. You understand? Normally, when a child is born, because the liver is not fully developed, it's possible to have some jaundice at that point in time. They will put the child in blue light. Then before you know what's happening, the child is okay. That's just normal. But you see that even when a child is preterm, you see that the liver is not yet fully developed. And that means the ability to process the components of blood when they are being metabolized is lost. Hence, bilirubin, which is part of those components, finds its way to the system and begins to color the eyes. And guess what? The basal ganglia, it causes kernicterus, and that is a problem that could also affect the brain. So you can see these are the things that. So its complications are often due to abnormal muscle tone, reflexes and motor development and coordination. Nerve damage is the key issue in this coordination. Remember that the brain is virtually a ball of nerves floating. So what are we talking about here? Now, the secondary issue is often the bone and muscle development as well as comorbidities. Any part of your body you are not using begins to wither off. That means even if you're not using a joint, the muscle leading to that area may become shorter, and that could lead to issues at the joint, stiffness and other things like that. It could lead to joint issues that may even lead to surgery. You may need surgery to really loosen up those joints again when the issue comes up. I'll talk about that shortly. Now, remember that the brain is necessary for learning. So, see, learning disabilities come there. And that's why you see that it's important. We may even need to just go back to the videos on it we have already on learning disability like autism, because a lot of similarities are there with regards to how these children can also improve speech problems and language issues. Pain is another issue because the nerves are actually what conduct pain to the brain. And if what is conducting pain is in pain or has problems, it will be terrible. Now, because sometimes they have to stay in one place for long, it's what we call pressure or bed sores. You understand? They develop and could be dangerous because they could lead to sepsis, which is infection of the blood, or actually just generally lead to death. Then bent spine, see that some children have the spine bends to the side. That's called scoliosis. That could be as a result of poor development of the muscles around the spine. That's another issue because you know that the nerves are not firing properly. Those muscles cannot grow because nothing is gingering them or motivating them to grow. That is justice. Just if you go back to our secondary school biology, you hear about John Lamarck's theory, use or disuse theory. Any part of your body you're not using, withers off. That is justice. So you see, now malnutrition also because the child cannot swallow because we need muscles to swallow as well. The brain coordinates that. So you can see there's depression, social stigma, and anxiety. The child wants to, hey, when imagine entering a place and being bent like this, how will people react? What's going to happen? And all that. This can lead to depression, social stigma, and anxiety because people begin to see them as different kinds of people, which is not so nice. Then we have cardiovascular issues, cerebrovascular issues like stroke. So have a high tendency to have things like cancer, trauma, injury, weak bones because the body is not being used the way it's supposed to. And the person is not taking enough nourishment as a result of the issues in the throat, you understand, and a lot of other issues like that. But remember that pneumonia can also happen because sometimes when the person is eating, the person with cerebral palsy is eating, because of the defect in regards to the muscles that help to swallow, you see that the person may have the tendency to take in food the wrong way, and that can lead to pneumonia. So management, apart from the use of chemical drugs, therapies, and neurosurgeries, etc., entail the use of natural pharmaceuticals. And this is how natural pharmaceuticals help in regards to this issue. Of course, they help to manage the cardiovascular issues involved, manage cerebrovascular issues, essential fatty acids of brain food, mitigate pain, because we know that we have natural substances like the anthraquinone. We also have essential fatty acids that also help to mitigate pain. You understand, without having to use hepatotoxic stuffs for so long and so much, because you know that paracetamol is actually a liver cell toxic drug. That's why we say it's hepatotoxic, because it's a liver poison. Paracetamol is a liver poison. And but we find ourselves having it in circulation in such a high amount. Then we have improved neuromuscular function. They can help to do that. Provide neural transmitters for improved brain function. That's neuroconnectivity and mood. Remember, we talked about choline being a precursor of a neurotransmitter in the brain called acetylcholine, which is also very, very, very closely related to the factors that are involved with what they call the parasympathetic or the calming axis. You know, we have you can Google this. We have the sympathetic and the parasympathetic axis. You can see that the parasympathetic axis has a lot to do with, bringing the body that could calming people down. Unlike this sympathetic axis that prevents people from fight, flight, or fright. And then you have things that can help to relax the brain, like the chamomile and all that. We also have things that can help to improve the maintain bone and joint integrity. Of course, magnesium. We have dicalcium malate, 125 dihydrocholecalciferol. Sorry, that's vitamin D and all that. Of course, rapid healing of injuries, because you know that these children have a high tendency of having injuries because of poor muscle posture and loss of balance. You understand? So that's why we have things that can help them to heal fast as well amongst these natural pharmaceuticals. These are just a few examples of what I give to patients. Well, we can't talk so much about them now, but we can just have a look at them, have a glance, and you will see that each and everything here has a function and reason why it is here with regards to cerebral palsy. And that's why this red one that came in last is super, super, super important, because it contains L-arginine, which is an amino acid that is essential for building up muscles. And you can see we're talking about neuromuscular function. So you can see, apart from that, it also helps to improve blood vessel perfusion, because it makes the blood vessels expand because of the production of nitric oxide and some other big grammar I would not like to confuse us with for now. But if you want to know more about it, I can talk with you one-on-one on private. And that's just on a lighter note and all. So we have a lot of things here that can help regards to cerebral palsy. Okay, let's just talk briefly about dyslexia. It's just an intro. Future will talk more about these things. Now, it's simply a learning disorder that affects reading, language skills, making it difficult to read, spell, write, and comprehend. You see that these things are all interrelated. There are things that are common between ADHD, autism, cerebral palsy, Down syndrome, and dyslexia. That's why they are even they're so related. You understand? The only thing there that ADHD does not necessarily affect intelligence. You understand? That's just the only thing. The child can have ADHD and be intelligent. You understand? So that's the only difference between the other four. But they are very related with regards to brain function. Now, it's often in association with attention deficit hyperactivity. Okay, look at what we're talking about. It's already here looking at us. You see, so dyslexia affects about 5 to 17% of the population. In fact, there are people around us that are having dyslexia, but they have just, there's what we call let my people go, just escapes. You understand? Some politicians too may even have dyslexia. You understand? Some of them want to say something and they say for up to 200 times. You understand? Because sometimes we have what is called a characterocratic system that applies in different places. So people like anybody can have dyslexia and still make it in life, depending on how it is handled. Understand? And the earlier, the better. That's what I'm going to. So problems may include difficulty writing words, reading out words from the head, reading quickly, spelling words, pronouncing words when reading aloud, understanding what another person has read. Sometimes it's also difficulty with rhyming words as well. Remembering dates, names, etc. Learning names and sound of letters. These are just, some of the problems associated with it. So people with this disorder often have a normal desire to learn. That's why it's not good to water or be wet blankets to them, because it could make them give up. And that's why we always need to encourage people, because anybody could have this issue. Nobody came with a written agreement from heaven onto earth and say that they're going to have dyslexia. So we just have to take it easy with people that have conditions like this. These are the causes and risk factors: the family history of dyslexia or other learning disability, low birth weight, premature birth, exposure to substances during gestation that affect brain development. So mothers have to be careful. Even fathers and husbands have to be careful, because if you keep annoying your wife all the time and you keep making her so upset, and she's having adrenaline in her system 24/7 when she's pregnant, with all the stressors, the cortisol and all that being swimming all around, and she begins to take alcohol or begins to smoke all sorts of things, and finally smokes dyslexia into your child, at the end of the day, you are also going to suffer, because you are going to pay extra for special schools and all that. So it's teamwork. When a woman is pregnant, men have to make sure that this woman, not only because of the woman, but because of the child, you have to make sure your wife is always happy. It's very, very important. And also make sure that your wife is taking the right things. You understand? You see, these things sound funny, but at the end of the day, they are all connected. So we need to be careful how we handle our women when they are pregnant. And women also have to be careful how they handle themselves when they are pregnant as well. You understand? Because the end result can be terrible for both parents. So these are the complications. You can see that the child may begin to struggle in school, have low self-esteem, because children with dyslexia can develop low self-esteem if they are made to feel unintelligent or lazy due to their condition. You can see that. And you can see that because they are struggling in school, they can even drop out. There's mental health issues, because it can lead to the risk of anxiety and depression and suicidal tendencies. Of course, it can lead to behavioral problems, because the children may begin to become rebels, because you understand, after all, people are frustrating them because of their condition and all that. And then they may have they may just lose interest. They become disinterested and unmotivated as a result of their condition due to this. They are struggling with the problem. That's why we need to handle this project. This is how we manage dyslexia. That should be detected early. We have what we call the multisensory instructions, where you can see that you can be, if you are saying A is for apple, and the child is reading A for apple, is saying it out, and things like that are called like the Gillingham pattern. We have the yes, The phonics-based instruction is also important. Assistive technology, text-to-speech software is also wonderful to help with that. And a whole lot of others, occupational therapy, speech and language therapy, as aforementioned, parent and teacher support and training, amongst others. These are very, very essential and very important to note when we're talking about management of dyslexia. So this is how natural pharmaceuticals can help in management of dyslexia, not cerebral palsy, because they help with essential fatty acids and brain food, provide natural neurotransmitters for improved brain function and ability, improved nerve function in the brain. Sorry about that. These are just examples of the things that are needed. But before we go, because I just wanted to do this to, so that we don't just leave other intellectual disabilities. We've been talking about autism, and the videos are all over different platforms on social media. So let's just also talk a bit about this, so that mothers that are having children that have these issues, we will have an idea of what the situation is. Of course, we'll talk more about the do's and don'ts, the diets, and the natural compounds that will be used, that are essential to help with these other intellectual disabilities. I'm talking about Down syndrome, cerebral palsy, and dyslexia. We have compounds that can actually help. We'll talk about those ones later as well. But before I leave us, I want us to also remember to consult with a health practitioner or a registered dietitian to determine the best dietary approach for specific needs. Additionally, consider consulting with a professional before making significant changes to diet. Don't just do things carelessly, because I've heard a lot of things. I've heard of women giving their children things that are highly contraindicated, and when I show them the research that proves it, you hear them shouting, "Oh my God, I've been giving this child this thing for years, wondering what's happening." And when they pull it out, they start seeing the child improving immediately. And you see, these are things that we need to also be cautious. But as health practitioners, we and also other professionals that are involved in management of intellectual disabilities have the training and have the capacity to assist us in many ways with regards to helping our children get better. Okay, so at this point in time, I just want us to know that you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the winning side. So thank you everybody for coming. And so say, God bless you. I really appreciate everybody for coming. And at this point in time, I would say good night and God bless. Bye.